An active approach to hemostasis, exploring the coagulation cascade. Hemostats may be categorized as active or passive based on their mechanism of action. Efficacy of these agents may be impacted by a patient's coagulation status. Hemostasis is the physiological process that stops bleeding at the site of an injury without forming clots elsewhere in the circulation. Vasoconstriction serves to contract blood vessels, decreasing blood flow to the injured area. A platelet plug is formed by aggregation of platelets, which also activates the coagulation cascade. A platelet plug induces formation of a fibrin network by converting fibrinogen to fibrin in the presence of thrombin to form a clot. Upon achieving hemostasis, tissue healing can begin. Individuals who have a coagulopathy or are treated with antiplatelet and/or anticoagulant medications may be compromised in their ability to activate platelets or form thrombin, risking greater blood loss. When deciding to use an adjunct hemostat, the patient's coagulation status, which can be impaired by medications, should be considered when choosing between an active or passive hemostat. Passive agents rely on platelet aggregation or activation as well as normal formation of thrombin. Coagulation must be intact. Achieving successful hemostasis with passive agents is limited to low-level bleeding and impaired by the patient's coagulation status. Passive products include oxidized cellulose, collagen, gelatin sponges, polysaccharide spheres or powders. Active hemostats are effective in patients with both intact or compromised coagulation. They can also achieve hemostasis over a broader range of bleeding. Unlike passive agents, active agents activate thrombin to promote clot formation by using the patient's fibrinogen to achieve hemostasis and facilitate tissue healing. Active hemostats include products in the following categories: flowables which contain thrombin and gelatin, fibrin sealants, advanced patches with PEG or fibrin sealants. In addition to hemostats, sealants work independent of the coagulation cascade to mechanically seal tissue. Baxter's portfolio of active hemostats and sealants include FlowSeal, TISeal, HemoPatch, CoSeal. Baxter's portfolio of active hemostats effectively achieves hemostasis over a wide range of bleeding grades across multiple surgical specialties and anatomies. Baxter's active hemostatic portfolio helps to reduce bleeding complications that optimize operating room efficiencies to improve patients' outcomes and reduce overall costs.